everyone! Today we're diving into one of the most magical and sometimes nerve-wracking journeys of life: pregnancy. Whether it's your first baby or your third, one thing never changes: the overwhelming number of do's, don'ts, and maybe just might be okays. And let's face it, with so much information out there, it's easy to get confused. The truth is, while every pregnancy is different, there are a few universal lifestyle habits and gentle practices that can support both mom and baby through these 9 months. And no, we're not here to dish out medical advice. Always consult your doctor for anything clinical. But if you're wondering what kind of routines, food, or mindful actions might help support your baby's growth and your own well-being, you're in the right place. Let's get into it with practical steps, good vibes, and a sprinkle of humor. Step 1. Nourish your body like a queen. Pregnancy is not the time for dieting or skipping meals. It's time to feed your body like your royalty. Not only are you growing another human, but your own body is working overtime to support the process. What to eat more of? Colorful fruits and veggies. Think rainbow on your plate. They're packed with antioxidants, fiber, and hydration. Aim for at least 5 servings a day to boost immunity and support baby's development. Whole grains, brown rice, oats, quinoa. These slow-release carbs can keep energy levels steady and prevent blood sugar spikes. They also help with digestion and constipation, which can be common in pregnancy. Lean proteins, eggs, lentils, tofu, chicken, or beans. Protein is essential for the baby's tissues and muscles. Try to include a source of protein in every meal to maintain steady energy and reduce cravings. Healthy fats, avocados, nuts, seeds, olive oil. Fats help brain development and keep you full longer. Omega-3 fatty acids especially play a major role in your baby's brain and eye development. Calcium-rich foods, dairy, almonds, sesame seeds, or fortified milk plants. Calcium supports the baby's bones and teeth and protects your own from getting depleted. Iron-rich foods. Think leafy greens, beans, or pumpkin seeds to support increased blood volume. Pair with vitamin C-rich foods like oranges or tomatoes to boost absorption. Smart eating habits. Eat small, frequent meals if you feel nauseous. Keeping your stomach slightly full can reduce queasiness. Stay hydrated. Add lemon or cucumber to your water if plain water makes you queasy. Herbal teas can also be soothing. Keep snacks handy. Dry fruits, granola bars, or whole grain crackers are lifesavers when hunger strikes mid-errand. Avoid skipping meals. It can lead to dizziness, fatigue, or heartburn. Step 2. Exercise. Yes, even with a belly. You don't have to morph into a prenatal yoga goddess overnight, but trust us, movement matters. While that growing belly might tempt you to stay glued to the couch, staying active, safely, can be a total game changer during pregnancy. Regular movement helps with blood circulation, reduces swelling, boosts your mood, and might even make labor a bit more manageable when the time comes. Safe exercises during pregnancy. Walking. This one's the MVP of pregnancy workouts. It's free, low impact, and keeps your body moving without any fancy equipment. Even 20 minutes around your block can lift your energy and improve circulation. Prenatal yoga. Not only does yoga stretch out those tight hips and back muscles, but it also teaches you how to breathe through discomfort. It's a very handy tool for labor. Plus, it's great for calming pregnancy anxiety. Swimming. Feeling heavy and uncomfortable? Water is your best friend. Swimming or even gentle water aerobics takes the pressure off your joints and lets you move freely. Pelvic floor exercises, Kegels. These sneaky little squeezes strengthen the muscles that support your uterus, bladder, and bowels. Strong pelvic muscles may help with postpartum recovery and reduce the risk of incontinence. Tips for safe movement. Always warm up and cool down to avoid strain or injury. Think of it as waking your body up before the action and easing it back into rest. Stay hydrated during workouts. Dehydration can sneak up faster during pregnancy, especially if you're exercising in warm weather. Avoid lying flat on your back after the first trimester, as it may restrict blood flow. Instead, opt for side lying or elevated positions when stretching or resting. Skip high-impact sports, contact sports, or anything with a risk of falling. So no horseback riding, skiing, or hot yoga marathons for now. Most importantly, listen to your body. If something feels off, stop. Dizziness, short of breath, or any kind of pain is your body's way of waving a red flag. Rest is also productive. Pregnancy isn't about pushing your limits. It's about honoring your body and keeping it strong, flexible, and balanced. Even 10 minutes a day of mindful movement can uplift your mood, ease aches, and remind you that you're still in charge of your body, baby bump and all. Step 3. Avoid the no-nos. Seriously, they matter. Growing a baby isn't all glow and giggles. There are things you really need to avoid to protect your little one. What to avoid? Alcohol. There's no known safe amount. It can lead to developmental issues like fetal alcohol syndrome. Smoking and secondhand smoke increases the risk of premature birth, low birth weight, and respiratory issues. Recreational drugs, harmful at any stage both for your body and the developing baby. Certain medications. Always consult your doctor before taking anything, even over-the-counter meds or herbal teas. Toxic household cleaners or paint fumes. Switch to natural or pregnancy-safe alternatives. Cat litter. It may carry toxoplasmosis. If you have a cat, delegate litter duty. You're welcome. Emotional no-nos. Chronic stress and overworking. These can increase cortisol, affecting both you and your baby's development. Negative self-talk. You're growing a human. That's a superpower. Be kind to yourself. Step 4. Keep up with doctor appointments and screenings. Look, we get it. Prenatal appointments aren't exactly spa days. Some feel rushed, others awkward. Pelvic exams, anyone? And waiting rooms can test your patience. But these check-ins are more than just a box to tick. They're like pit stops for you and your baby's well-being. Think of each appointment as a behind-the-scenes scan of how your body's doing this incredible thing, creating life, and that deserves attention. Key appointments to expect. Ultrasounds. The first one, usually between 8 to 12 weeks, confirms your pregnancy, checks the due date, and lets you see that tiny flickering heartbeat. The mid-pregnancy scan, 18 to 22 weeks, gives a full picture of your baby's development, organs, limbs, heartbeat, and sometimes even the gender, if you're curious. Blood tests. Not the most fun, but super important. These test for anemia, infections, blood type, Rh factor, and screen for gestational diabetes, all of which can impact how you and baby feel. Prenatal screenings. These optional tests can check for genetic or chromosomal conditions. Your provider will explain what's involved so you can make informed choices. Please don't skip these basics. Tracking your weight and blood pressure might seem boring, but they help detect early signs of preeclampsia or other issues. Reporting symptoms, even the ones that feel strange or embarrassing, is crucial. Nothing is too small or silly to mention. Asking questions makes you an empowered parent. Whether it's about weird cravings, sleep positions, or discharge, ask. Your doctor has heard it all before. Remember, your healthcare provider is not just a person in a white coat. They're your partner in this journey. Being proactive, honest, and involved in your care can make a huge difference. Think of it like this. Every appointment is a progress update in the most important project of your life, bringing a healthy baby into the world. Step 5. Nurture the mind and spirit. A calm mom helps grow a calm baby. Mental and emotional wellness are just as important as prenatal vitamins. Mindfulness practices. Meditation or deep breathing helps reduce anxiety and connect with your baby. Prenatal journaling. Write down your feelings, dreams, and hopes. Connect with other moms. Whether online or in real life, it helps to share the experience. Prepare for motherhood. Read up, but don't overwhelm yourself. Choose a couple of trusted sources. Start creating a baby budget or nursery plan, but don't stress it if it's not Pinterest perfect. Bond with your partner. Go for walks, take birthing classes together, and talk about baby names, even the ridiculous ones. Pregnancy isn't about perfection. It's about being present. Trust your instincts, surround yourself with support, and celebrate the little milestones. Let's be honest, pregnancy is a wild ride. Some days you'll feel like a goddess. Other days you'll cry over dropped toast. But with mindful steps like nourishing your body, moving with intention, and avoiding harm, you're setting the foundation for a strong, healthy baby. You don't need to do everything perfectly, just consistently. So breathe deep, rub that belly with love, and know this, you're not just growing a baby, you're growing a mother too. Now go eat that avocado toast. You deserve it. Don't forget to like, subscribe, and hit that notification bell for more science-backed nutrition content that doesn't put you to sleep. Stay fit, stay sharp, and we'll see you in the next video.